Dr. Sajid here again. I'm often asked a question about how to decide where to take your child for medical care and attention. In other words, how do you decide which doctor to select for your children? And today we're going to talk about this in some detail, and I'll give you my opinion about this. So first, I think you need to know the qualifications and the expertise of the doctor that you're going to select, especially in the field in which he specializes. So if it is children, then you should know whether he has enough experience or not, and whether he is knowledgeable about this particular field. So you may have to talk to different people. Mostly what happens is that you get an opinion from your friends. You often seek help from your relatives or people that you work with. Others who have been to a particular doctor may also help. Now you also want to know where is it that this particular doctor works. In other words, where does he or she see patients in consultation? Is it only a private clinic, or does he or she also go to a particular hospital? Is he associated with a hospital? And you also want to know the timings of the clinic. So does he see patients by appointment, or do you just walk in and the child can be seen? Similarly, is he associated with a particular hospital? And also, what happens in odd times, especially when there are no clinic hours or the clinic is closed, in the evening hours, at night, or on holidays or on weekends. So please ascertain how you will be able to get through to the doctor, and there should be clear instructions about this available. You also need to know what happens in an emergency. Is he associated with an emergency room or with a hospital, and will the hospital be able to contact him or her when you need the doctor for your child? If you're concerned about your newborn and you want a doctor who will look after the baby right from birth, then you want to know what will happen when the baby is born. Does he go to a particular hospital? Does he recommend one? And if you go to that hospital and deliver a baby, will the doctor be able to come and see the baby there and examine the baby there? Or if not, how soon after birth will the doctor be able to examine the newborn? Other things that you may want to know is what happens if you just want to get some information from the doctor. You may not feel that you need to visit the office or the clinic, but that you want some information. So, for example, is the doctor available on the phone? Can you send a message to him? So does he have, for example, is it easy to reach him with an SMS message, or these days through online consultation, or, for example, WhatsApp messages? You also need to find out about the tendency of the doctor, his philosophy. Does he believe in using a lot of medicines? Does he believe in using a lot of injectable medicines? For example, there are doctors who like to stay with medicines that can be taken by mouth. There are others who use a lot of injections. Of course, I feel that if a child can take medicines by mouth, that is better, and only rarely should injectables be used. Also, again, in my opinion, you need to know whether the doctor uses a lot of antibiotics for even simple problems, especially if you think the doctor uses unnecessarily a lot of antibiotics then I think you should think twice. Another concern that patients have is, does the doctor order a lot of tests? And sometimes people think that tests may be done unnecessarily, so this is also something that you want to keep in mind. And lastly, what is the, how does the doctor deal with the patients? The attitude of the doctor towards the patient, towards the parents. Does he listen to you, listen to the complaints? Does he explain the condition of the child to you and also give you instructions that are very, very clear? So if a doctor has all of these qualities, then I think by all means this is the doctor that you should select. Of course, selection of doctors is always a personal choice. These are some helpful points. I hope they will help you.